Hi, welcome to Health Place. Please subscribe to my channel and hit the notification bell if you are yet to do so. In this video, we will be learning about the 8 signs and symptoms that indicate that our body lacks vitamin D. Vitamin D is a very important vitamin that has great effects on numerous systems in your body. Unlike other vitamins, vitamin D functions as a hormone, and every single cell in your body has a receptor for it. Your body produces vitamin D from cholesterol when you are exposed to sunlight. It can also be obtained from foods such as fatty fish and fortified dairy products. Although it is recommended to take around 400 to 800 U of vitamin D daily, experts have advised that you should get even more than that. Vitamin D deficiency is very common. Statistic has shown that about 1 billion people across the globe have low levels of the vitamin in their blood. In 2011, a study revealed that 41.6% of adults in the United States are vitamin D deficient. Here are some common risk factors for vitamin D deficiency. 1. Having dark skin. 2. Always using sunscreen when going out. 3. Being elderly. 4. Not eating much fish or dairy. 5. Being overweight. 6. Living far from the equator where there is little sun year-round. People who are near the equator tend to get frequent sun exposure and are less likely to be suffering from vitamin D deficiency. Most people don't even realize that they have a shortfall in vitamin D, because the symptoms are generally subtle. Here are 8 signs and symptoms of vitamin D deficiency. Number 1. Getting infected and sick often. Vitamin D's most significant role in keeping your immune system resilient so you are able to fight off infection-causing bacteria and viruses. Vitamin D directly interacts with the cells that are needed for warding off infection. If you fall sick often, mainly with colds or flu, the leading cause could be vitamin D deficiency. Also, a low level of deficiency has been linked to respiratory tract infections like bronchitis and pneumonia. Number 2. Tiredness and fatigue. Although tiredness and fatigue could depict several underlying issues, vitamin D deficiency may be one of them. But sadly, it's often unnoticed as a potential cause. For instance, there is a case of a woman who consistently complained of severe daytime fatigue and headaches. Upon investigation, she was found to have a vitamin D blood level of fewer than 20 nanograms milliliter, which was the lower limit of the normal range. This is extremely low. The symptoms were resolved the moment she was placed on vitamin D and her blood level rose to 39 nanograms milliliter. Nonetheless, even blood levels that aren't very low may have a negative impact on your energy levels. Excessive fatigue and tiredness may be a sign of vitamin D deficiency. Taking supplements may help improve energy levels. Number 3. Consistent bone and back pain. Vitamin D helps to sustain bone health in several ways. It promotes calcium absorption in the body. Regular bone and lower back pain may be an indication of inadequate vitamin D nutrients in your blood. Number 4. Depression. Also, falling into depression always may be a sign of vitamin D deficiency. Some research studies have related vitamin D shortage to depression, mainly in older adults. In one analysis, 65% of the observational studies found a relationship between low blood levels and depression. Depression is associated with low vitamin D levels, and some studies have found that supplementing improves mood. Number 5. Slow wound healing. Slow healing of wounds, especially after undergoing surgery or injury, may be a sign of vitamin D deficiency. Laboratory test studies have suggested that vitamin D promotes the production of compounds responsible for the formation of new during the wound healing process. Also, it was discovered that healing was compromised due to vitamin D deficiency in a patient who had undergone dental surgery. Vitamin D helps in checkmating inflammation and fighting infection, for proper healing. Number 6. Bone loss. Vitamin D plays a crucial role in calcium absorption and bone metabolism. Many older people who are diagnosed with bone loss believe they need to take more calcium. However, they may be deficient in vitamin D as well. Low bone mineral density is an indication that your bones have lost calcium and other minerals. This places older adults, especially women, at an increased risk of fractures. Adequate vitamin D intake may be a good strategy for protecting bone mass and reducing fracture risk. Number 7. Hair loss. Hair loss is often attributed to stress, which is certainly a common cause. However, when hair loss is severe, it may be the result of a disease or nutrient deficiency. Hair loss in women has been linked to low vitamin D levels, though there is very little research on this to date. Alopecia areata is an autoimmune disease characterized by severe hair loss from the head and other parts of the body due to vitamin D deficiency. Low vitamin D levels are linked to alopecia areata and may be a risk factor for developing the disease. Number 8. Muscle pain. The causes of muscle pain are often challenging to identify. There is some substantiation that vitamin D deficit may be one of the causes of muscle pain in children and adults. Some studies have found that consuming high-dose vitamin D supplements may reduce various types of pain in people who are deficient. Vitamin D deficiency is very common and a good number of people are unaware of it. That's because the symptoms are often mild and generic, which means that it might be difficult to point out if vitamin D is really the cause. If you think you may have a deficiency, it's vital that you speak to your doctor and get your blood levels measured. The good news is that a vitamin D deficiency is usually easy to fix. You can either expose yourself more often to the sun, eat more vitamin D-rich foods or products. You can also find a variety of vitamin D supplements on Amazon. I have included the link in the description box. Please feel free to share with others some names of vitamin D-rich food that you know.